All right, so today we are going to start a separate category of disorders. So far we've talked about anxiety disorders and dissociative disorders. Today we're going to be looking at defining mood disorders and contrasting major depressive disorder, bipolar disorder, and dysthymic disorder. But when we look at defining mood disorders in general, they are characterized by emotional extremes. So mood disorders are psychological disorders characterized by emotional extremes. The first one is the one that I think we're most familiar with, major depressive disorder. And this is just your major depression, or when you hear people talk about people with a diagnosis of depression, the clinical name of it for it is major depressive disorder. And a lot of us can relate to what depression feels like. You know, most of us at some time during our lives have experienced dark moments where we feel the symptoms of depression. We're a lot of times discouraged about the future. We're dissatisfied with our life. We feel isolated from the people in our life. We may lack energy to get things done. You might even have to force yourself out of bed. You might not be able to concentrate, eat. Your sleep patterns might be interrupted. But I think what's important to understand is with major depressive disorder, these symptoms that I was just talking about are persistent. They last more than 2 weeks, and you have many of the symptoms that I described. And you can see what's listed below as some of those symptoms: depressed moods, feelings of worthlessness, diminished interest in activities that we, for the most part, enjoy and bring us pleasure. What's also important to notice with this particular definition is that it's in the absence of drugs or a medical condition, because sometimes depression can coincide certain medical conditions or with certain drug use. So major depressive disorder is marked by 2 or more weeks of significantly depressed moods, feelings of worthlessness, diminished interest and pleasure in most activities. Where when I was talking earlier, a lot of us can relate to these symptoms, but they aren't as persistent. They don't last for as long, and we find that those depressed states lift after a day or two. So additional symptoms that characterize major depressive disorder is lethargy. And this might be something that some of you aren't familiar with. It's just this loss of energy. You just can't even move. You can't get out of bed. You don't have any energy whatsoever. Obviously, feelings of worthlessness, you really start to question yourself. You have low self-esteem. You don't value yourself. You don't like who you see when you look in the mirror. Another major symptom is a loss of interest in family, friends, and activities that normally bring you pleasure. I also think that it should be listed but isn't, is marked appetite. A change in appetite. Sometimes people will find that when they are in a depressed state, they have no appetite whatsoever, or they want to eat everything in sight. You usually see one of 2 extremes. And same with sleep patterns. Some people find that they want to sleep all the time, almost as a means of escape when they are in a depressed state. Or they may find that their depression gives them insomnia and they can't fall asleep. Or if they do fall asleep, they wake up and can't fall back to sleep. So these are characteristic symptoms. When we look at depression, there are all kinds of causes. Some are genetic in origin, family predisposition. Someone may look at a person who's depressed and wonder why. They've had nothing happen to them that's been traumatic. They have a really good life. Everything seems to be good. Why is it that they're suffering from depression? Well, they have, chemical imbalances, or they have some abnormalities in their brain structures, or they truly just have a family history. And unfortunately, they may have the diagnosis. Other diagnoses are truly environmental. People can become depressed because of a loss of a loved one or a physical condition. They may have had just hardships and traumatic events that have brought about the onset of the depression. So there's so many different types of depression and causes for depression. Another type of depression that most people haven't heard of is called dysthymic disorder. Dysthymia or dysthymic disorder. And this is a down in the dumps mood that fills most of the day, nearly every day for 2 years or more. But what really separates dysthymic disorder from major depressive disorder is the ability to function. Most people with depressive disorder, major depressive disorder, will not be able to hold down a job or go to school or maintain relationships because their depression is so debilitating and so severe. With dysthymic disorder, they just feel like a black cloud, a storm cloud is following them everywhere. But they still can get to school, they still can hold down a job, they still have friends, but they're just not happy. They're sad, and this sadness is not, it doesn't lift. We have our good days and our bad days, most of us do, but people with dysthymic disorder just have bad days. They might suffer from low energy, self-esteem. They might have difficulty concentrating or making decisions. They sleep and eat either too much or too little. So a lot of us can relate to being in kind of a foul mood or a blue mood and being sad. Then there's dysthymic disorder, which is somewhere in between having, our bad days and being diagnosed with more severe depression. Bipolar disorder is the third type of mood disorder that we talk about. And this is a mood disorder in which the person alternates between the hopelessness and lethargy of depression and the overexcited state of mania. So we'll talk about kind of how they have these two sides to their personality. In fact, bipolar disorder is sometimes misdiagnosed or confused with multiple personality disorder or dissociative identity disorder, which we talked about yesterday. Because their emotions are so extreme, it's almost like they're two different people. However, they are not. They are the same person, they just have alternating moods. When we look at bipolar depression, we can look at the depressive symptoms, and then we can look at the manic symptoms. The depressive symptoms are just like what we talked about with major depressive disorder. Gloomy, withdrawn, they have a hard time making decisions, they're tired, they just have a hard time even processing information, almost a slowness of thought. The manic symptoms are almost like they're on some kind of amphetamine or upper. They are elated, they have these feelings of euphoria. They almost have this belief that they are better than they actually are. They need very little sleep. They want action all the time. It's almost like they're poured too much personality, like they're hyperactive. They have so many ideas, they have a hard time focusing. They can switch from one thought to the other. And they oftentimes get in trouble when they're in the manic state because they don't think about consequences and they don't feel like anything bad will ever happen to them. So they may go on shopping sprees, only later to be depressed by finding out they've emptied their bank account or racked up credit cards. They might even be sexually promiscuous because they don't think about the consequences and getting diseases or being pregnant or who they might be hurting if they have a relationship with someone. And so in the manic state, it's like they're on top of the world. But we know when our body is in this overactive state, it can only stay in this high hyperactive state for so long, and then reality sets in, and the depressive symptoms can once again surface. In our book, it talks about how a lot of people can be very creative in the manic state. Many great writers, poets, composers suffer from bipolar disorder. During their manic phase, the creativity surges, but obviously not during their depressed phases. So these people listed below, Whitman, Woolf, Clemens, and Hemingway, have all had the diagnoses of bipolar depression. So in the manic state, it's marked by this hyperactive, wildly optimistic state. What you see here is a patient, while waiting in the waiting room for their counselor, they just have all these ideas, racing thoughts. And this is a picture that was drawn within 15 minutes of all these different ideas while they were waiting. So you can see this rush of euphoria and how nonsensical it is and how it just transitions from one idea to the next. And so they're very scattered oftentimes in this manic state. When we look at explaining mood disorders, there are all kinds of components. Remember, I talked about that before. The genetic influence, obviously, there's a genetic link to depression. The rate of depression is higher in identical twins than in fraternal twins. So we know that there is a genetic component. You are more susceptible if you have depression in your family. They've looked at chemical imbalances. Excuse me. They've found that people who are depressed do not have normal levels of norepinephrine, which we know is kind of this upper. It puts our body into a heightened state. And then serotonin. We've talked about this throughout the year and how lower serotonin levels are found in people who have depression. So we do find that there are medications that can help with depression, especially if it's the type of depression that we know is linked with chemical imbalances. There are drugs that alleviate manic states by reducing the amount of norepinephrine. So people who are in the manic phase, they have high levels of norepinephrine that put them in this kind of racing thoughts, almost like they're on an amphetamine of some kind. The social cognitive perspective definitely suggests that depression arises partially from these negative thought patterns, the self-defeating beliefs, and this feeling of kind of learned helplessness. So they have negative thought patterns. Remember, we talked about frontal lobe activity and how in the right frontal lobe we have these negative moods, and they may have an overactivity of the negativity in the prefrontal cortex on the right side, in the right hemisphere, and they might view life with self-defeating negativism, and everything is kind of glass half empty in their world. So we look at how there's biological influences, there's psychological influences, and there's also environmental influences, traumatic negative events, cultural expectation, depression-evoked responses. So this is like a perfect storm for someone who is highly vulnerable to suffer from depression. All right, and then I'm going to have to exit out of this screencast because I'm not going to have enough time to show you this link. But this crash course psychology link shows a really good 10-minute clip of what we've just talked about with mood disorders. So I'm going to have you watch that as well.